And I remember my parents telling me as a child, if I was getting stressed, hey, take a few deep breaths, you know, you'll feel better. It's kind of an old wives' tale, because actually physiologically in their body, that's exactly the opposite of what you want to do. If you're already breathing faster than your body needs because of anxiety, and you now tell a youngster to take 5 or 10 deep breaths, they're actually going in the opposite direction. In other words, that the anxiety is causing them to breathe too much already. We're maybe slowing down the frequency of breathing, but we're actually having a huge volume. So like when I did that just once, I got a little lightheaded just doing it one time. So the idea is what we actually want to do is instruct them in something that not only is going to slow the frequency of their breathing down, but shrink the volume back down to basically normalize breathing. We encourage people to breathe in and out of their nose only. Why is that? Because if your goal is to slow your breathing down, your nose is a smaller hole. You're going to get less air in and out of your nose than you can your opened mouth. Now some people say, well, now I was actually taught once to breathe in my nose and out my mouth. Can I do that? Yes, you can, but we really encourage people not to do it that way because it's one more thing to think about. In addition to that, you want to instruct them to breathe in for a count of 2 and breathe out for a count of 4. We're really extending the exhale out over a count of 4 because you can't breathe in and out at the same time. So as you're breathing out for a count of 4, you're having to wait naturally before you can draw more air in. That is going to be a much more effective way for anyone to manage their anxiety. This is the quick and dirty version that we usually do with young kids, and this is the quick and dirty version. For example, if someone were to call me in my office in the midst of a panic attack, this is what I would have them do over the phone. I'm just going to kind of say kind of the cadence out loud so you can kind of get an idea of how fast the 2-4 ratio should be, or how slow I should actually say. And if you want to add the diaphragm thing, go right ahead. That's kind of breathing, 200 level breathing, right? The 2-4 ratio is kind of basically, but if you can get them to be doing the diaphragm, then you've really got something, because you're not only slowing the pace down, but you're then making them a more efficient breather, which will allow them to kind of keep that nice and slow pace to overcome their anxiety or their anger. So you ready?
Ready.
All right. So it's breathe in, 1, 2, breathe out, 1, 2, 3, 4. Breathe in, 1, 2, breathe out, 1, 2, 3, 4. Breathe in, 1, 2, breathe out, 1, 2, 3, 4. Now, how did that feel?
Just a little sleepy.
Well, that's exactly what we want, because you can't be
sleepy.
angry or anxious and be tired at the same time, right? So that's good. Now, sometimes people, when I ask them that question, they'll say, well, I actually feel a little lightheaded.
I was going to say a little.
If you and that wouldn't have surprised me based on what I was kind of seeing and hearing. A little lightheadedness is the sign that you're either doing it too fast, the 2-4 ratio is too fast, and you're getting in too many breaths per minute. But you were following my lead, so that's probably not the issue there. But chances are more, in this case, your breaths were too big. Okay, you were taking in too much. And the reason why I could tell is because I could actually hear you breathing where now I can't. So what that tells me is you were kind of pulling in air. The other thing to discuss with your students is breathing in and out of your nose, doing the 2-4 ratio, but also just really kind of taking a relatively normal sized breath in over that 2 count. In other words, this is not deep breathing. It's not lung-filling breathing, because that's exactly the opposite of what you want to be doing. It is a skill. It's trickier than the peace breaths, and it'll probably take them longer to kind of acquire it. But once they get the hang of it, I think they're going to find it more effective, and I think you're going to find it more effective for them.